Hey friends, welcome back to LlamaMamaKayla's YouTube channel. Thanks for stopping by for an update. I haven't updated in a little while because I have just been feeling so bad and in so much pain that I just did not care to brush my hair and get in front of a camera or anything like that. So today I decided I'm going to push myself and do an update and possibly even record a couple more videos if I can get around to it today. But I wanted to let you all know what's going on, and things have not been going good. That's the bottom line. Just to recap for anyone who's not been following along, I've had swallowing issues for several years now that were just progressively getting worse, and nothing was helping the issue. And it got to the point where I couldn't even swallow liquid at times, which was downright scary when you can't even drink water. And so I was hospitalized for that for a little while, about a week back in December. And then we finally got this test done that showed how much my esophagus actually is working. And come to find out, it does not work at all. And so they diagnosed it with Scleroderma that has hardened my esophagus, like turned my esophagus into a PVC pipe. It's just a straight pipe that doesn't, a normal esophagus kind of works like this, you know, as you swallow it, I don't know, constricts and moves food or liquid down. My esophagus does not do that at all. So my options were to get a feeding tube placed into my stomach, or to have my esophagus removed and my small intestines pulled up to create an esophagus, which that still would not constrict like that. It would just be a tube that was not hardened like a PVC pipe. So my doctor and I discussed the different options, and he strongly suggested the feeding tube, and he said it would just be easier surgery on me, easy to get over. The other surgery would be like a very hard recovery, and he said that getting a feeding tube would just be a night in the hospital, and then you'd go home and you'll heal up and be fine. Well, that selling point of one night in the hospital did not pan out so good for me, because on February the 10th, I went in and had the feeding tube placed, and I was in the hospital until February the 18th. And when they did let me out on the 18th, I still was having like major issues with it. But they let me go home to see if I could get more comfortable and heal better at home, because let me just tell you, being in the hospital is not comfortable at all. I hate being in the hospital. More than one night there is just too much for me, honestly. But I did have more procedures done to try to get my feeding tube working properly. It was just like leaking so badly. Like even when they put formula in, it would just come out all over my stomach around the tube. Like here's the hole in your stomach, and the tube liquid was coming out all around this hole. I mean, just like coming out. And so they kept replacing it to get it in a better position and stuff, and it just wasn't staying in that position. It was kept coming out of place and stuff. And so they did that like 2 times while I was in the hospital. And then I came home and I just tried my best to get better, tried to recover. The outside of my stomach around the stoma got pretty nasty because the gastric acids were coming out on my stomach and eating that skin. And so it got pretty bad, and the pain on the inside was just horrible. And, you know, like we'd been going on like 3 weeks post surgery, and it should have been healed, you know, and I should be able to move around and do things by then, and it just was not getting better. And so one night I was just really, really bad off and was just crying and just in so much pain. And so, and also I was in pain like sitting here at my desk, but when I would lay down in the bed, it was even worse pain. And when I would lay down, it was like I was paralyzed and I could not move my upper body. I couldn't shift my weight. I couldn't turn from my side to my back. I was just like paralyzed. Once I laid down, I could not do anything. And so I knew that wasn't right. Like something's wrong, something's wrong. So anyway, I ended up going back to the ER, and they did diagnose me with cellulitis in my abdomen. It was just so, so painful. Like, oh gosh, I can't even describe how painful that is. But besides the cellulitis in my abdomen, also, I was still having this pain on the inside, like deep on the inside, like this paralyzing pain that I'm talking about. And so they decided to keep me in the hospital and give me the antibiotics for the cellulitis, IV antibiotics. And then also the doctor, they did CAT scan with dye. They did x-rays. They did a ultrasound with dye. And then the doctor kept thinking about what I was saying when I was telling her, you know, that when I would lay down, it's like I'm paralyzed. I can't move. And, you know, just how rough it was, you know, like it should be healed by now. Like I'm talking about on the inside, not the skin and the cellulitis going on near the on top of the abdomen. I'm talking about deep inside. And so this particular doctor, she's a general surgeon at the hospital. She looked at the scans more closely, and she could tell that the tube was partly out of my stomach and wedged up into a muscle. And it was kind of like pinching that muscle and the stomach all together. And that's why I was experiencing so much pain on the inside. Well, I mean, I was saying was. It is slightly better because they did try to push the tube back into my stomach. And it gave a slight relief. So it's not quite as pinching feeling, but it's still very uncomfortable. And so anyway, I was in the hospital again all this time, and they were going to do the surgery. And so every day they kept saying, you know, okay, we're going to get you in to do the surgery today. And the plan was they were going to go in, sew my abdomen wall, the stomach up to the abdomen wall, stitch around that hole, or worst case scenario, close up this hole that this tube is in and make a new hole and place a new tube. So that's what I was looking at. And then, so every day they were going to do the surgery and it would get put off for some kind of reason. And then I was like, okay, we're going to get to you today. And then they didn't. The nurse came and said, okay, they're not doing your surgery today, but the doctor says she's coming to talk to you. And so she finally came around and she said that she felt like for my best healing, for me to be able to do the best healing, I needed to be off certain medicines that I was on for about 5 days before the surgery. And I totally agree with that. You know, I don't want to be on any kind of medications that's going to slow the healing down, because I'm ready to get it done and heal and get over this. So I appreciated her taking that time to study the medicines that I'm on and say, this is going to slow down her healing. So there was 3 medicines that I was on, so I'm not taking those 3 medicines. Okay, so she gave me the choice of staying in the hospital until they did my surgery Tuesday, which today is Sunday that I'm recording this video. So Monday, Tuesday would be the surgery. She gave me the choice of just staying in the hospital and let them kind of manage my pain, which they were not doing because I can't take strong medications. And just trying to keep me comfortable, which I was not comfortable because there's no hospital bed that is comfortable. I'm sorry. Or go home and come back for the procedure. So Jody and I talked real quick, and he said, you're going to be miserable if you have to lay here till Tuesday, and you're not going to do nothing but get madder and madder at everybody, and I'm going to be miserable, and everybody else is going to be miserable too. So I was like, you're right. So I had him to call the doctor back and tell her that I decided that I would just go home. Plus, I had an appointment coming up on Friday in Shreveport with the GI doctor who initially found out that my esophagus didn't work. And so I'd waited a long time for this appointment with him because, it's hard to get in to see him. And so I didn't want to lose that appointment. I didn't want to cancel it. And so I was just kind of hanging on to the appointment to see what happened before I canceled it. I was going to cancel it like the evening before. So when I had the choice to go home, I was like, okay, I'll be able to make my appointment in Shreveport with a GI doctor that I'm going to be using as my GI doctor after I get the tube and everything. So, like I said, we decided that I should go home for everybody's sake. And so that's what we decided, and that's what, I told the doctor. So she did discharge papers, and I came home. And just miserable in pain. Nothing helps the pain, which I don't take strong medications because they make me throw up. They just make me throw up. And I don't care, you can say Zofran helps, but it does not. I can take Zofran and the strong medications, and I'm still going to be throwing up. So, rocked on a few days, and then it was my appointment with in Shreveport this past Friday. So Jody took me over there, and I saw the GI doctor there, and he was so nice. I really, really like him. I don't really even know him. I've seen him that time that he did that test on my esophagus, and that's all. But I really do like him. And so he said that he didn't care for the tube that they put in, that he puts in a different type of tube and a bigger tube that doesn't easily get clogged and such. And so I figure he is a doctor that treats people with G-tubes. I mean, he treats any kind of GI issues, but I'm sure he treats people with G-tubes because he puts in G-tubes. And versus just a general surgeon doing it, I felt like he's going to do it a certain way because he's going to be treating that patient later, and a general surgeon's just going to be doing the surgery and moving on to the next surgery and seeing that person just for like a 2 or 3 week follow-up, and then that's all. So he said he was going to go out and call my doctor in Monroe and talk to them for just a moment. So he did, and then he come back and he said, hey, I'm going to put you a new tube in. And I don't know, I just felt a relief of him saying that, even though I don't even know him, but it was such a relief. And so I was kind of, my first thought was relief, like, oh good, somebody that really knows what they're doing. And my second thought was, oh gosh, I got to come to Shreveport and have that done. And then Jody's going to come and stay in a hotel, and, just how are we going to work all this out? And then I said, so I'm going to have to come here to have that done. And he said, no, I'm going to come to Monroe, which is the town I live in, and place a new feeding tube in you on Thursday. And I was just like, oh my gosh, what a blessing, And so he is coming here Thursday to close up this hole and make a new hole and put a new feeding tube in. So I feel really good about that. Although I hate to go through more surgery and be in the hospital more and all that, I just feel like that this is the answer to getting it done correctly. And, the road to getting better so that I can actually use the feeding tube, because I'm not able to use it right now. It just comes back out onto my stomach, and it's a mess, and it's horrible and very painful. And so he told me not to even I told him I wasn't using it, but I was flushing it in the mornings and at night just to keep it from getting clogged. He said it doesn't matter if it gets clogged. Just don't flush it. Don't do anything to it, even if it gets clogged. we're putting a new tube in. I was like, oh yeah, that makes sense. So tomorrow I have an appointment with the surgery team and do my pre-op. I guess I'll do my pre-op tomorrow, or they'll have me come back on Wednesday. But I'll do my pre-op and have to get another COVID test and blood work and all that kind of stuff for surgery. And then on Thursday, I'll be going to get a new tube put in, a new hole. They'll sew this hole up, and also where they did it before, they did 3 cuts because they did it laparoscopically. So they did 3 cuts on my stomach, so they're going to do 3 more cuts beside those cuts and sew up this hole, sew my abdomen and stomach wall together, and then make a new hole for a new tube. So hopefully Thursday I'll get this done. I'll be in the hospital a few days because you can't run any formula through the tube for like 24 hours, and then you slowly work some through, you know, and kind of build up. And so I suspect I'll be in the hospital probably through the weekend. I mean, I don't know for sure. If I'm doing good and they want to let me go before then, I'll be all for it. But I'm thinking probably through the weekend, just to make sure it's working correctly and healing and all that kind of good stuff. So that's where I'm at. And I've just been having a really, really hard time. Just in a lot of pain, and, you know, and so right now I'm trying to drink by mouth and get a little bit of nutrition in by mouth, and that's not going so well. I've been doing lots of throwing up, and I don't know. It's just not fun. It has not been a fun process, and I can't wait to tell my primary doctor when I see him again how that was not an easy surgery and one night in the hospital and going home. I feel like he tricked me. He really didn't know that, you know, I was going to have all these issues and problems with it. So, yeah, I just wanted to let you all know that I'm still hanging in. It's been rough, but it's going to get better. I know it is. I know that once I get this new tube put in, it's going to heal up, and I'm going to, you know, bounce back and be strong and get back to my life. That's what I miss. Like, I sit down at my desk here and I don't feel like doing anything. Like, I'll turn on a show and start watching a show for a little bit and just sit here and do a couple of stitches on something, and then I'm just like, oh, I gotta go lay back down. So I'm gonna lay back down, which is painful to lay down, but it's also painful to sit up. So there's just no answer. It's no answer, but it's gonna get better. It has to get better, right? Okay, guys, I've kept you all long enough, but I did want to give that update. And I appreciate you all. I appreciate your prayers. I appreciate the messages and comments and everything that you've left for me. It means so much to me. I'm just not physically or mentally up to responding to things right now. And by the time I am, we'll be moved on to something new. So just know that I've read and I appreciate you. I thank you all. And I'll see you all again very soon. Hopefully, I'm going to try to record up some videos this afternoon if I get to feeling a little bit better. I'll kind of rest after I do this one, and I might get some more videos. I was in the hospital for Valentine's Day, but when I got home, I had some new babies that they had ordered me for Valentine's Day. And so I want to post the openings of my new babies and tell some ideas and things that I have for those and what's going on. So I do have those videos and a couple more things. But anyway, guys, thanks for watching. I'll see you all again very soon.